Ovarian cancer can go undetected for a long time, making it especially dangerous. But diagnosis can be difficult, especially amongst Black women. Dr. Eleanor Ratner and health advocate Shantana Hazel are here now with more. Thank you both for being with us.
Good morning, Elsa.
Good morning.
Dr. Ratner, I want to start with you. What are the biggest obstacles that you face when you are trying to diagnose ovarian cancer?
So, Elsa, exactly as you said, ovarian cancer continues to be so deadly for a few reasons. One, because it is still just diagnosed so late in the course of the disease. And that is due to a couple things as well. The symptoms of ovarian cancer, especially at early stage, are vague. It is some bowel symptoms, some bladder symptoms, some weight gain, the clothes not fitting well. But unfortunately, the symptoms are so vague that many times they are considered to be normal, both by the women and also by providers who they see. And then, even when the women complain of these symptoms and present to the providers, unfortunately, we don't have great tests to diagnose these tumors, these cancers early. Traditionally, we do a combination of an ultrasound and a tumor marker called CA-125. And we have always known that these tests are not great. They have a lot of false positives, a lot of false negatives. But in particular, most recently, we really have understood that these tests are even worse for African American women or women of color.
And what can be done to improve the detection and survival rates for Black women?
Education and awareness. A lot of providers don't even know about this racial disparity. So it is very important that we're all aware of it, that we talk about it, and that we truly provide personalized care. We use tests that are evidence-based, better in those populations. And also, once these cancers are diagnosed, it is very important that these women are referred to expert surgical center, expert care centers that deal with this kind of cancers. Because we know from the literature that if women get good, better, great care, then the field is leveled and they do better.
Shantana, what are some of the other reasons why Black women may not receive more accurate diagnoses or treatment?
Well, Elsa, some of the reasons could be, are economic groups, right? And then we have the poor access to care. Some of the resources and just the overall generalized care that we need as Black women, we're not seeing that, we're not receiving that. And so now it's time, and this is where I come into as an advocate for over 10 years, just teaching women how to advocate for their health care, how to listen to their bodies, and how not to dismiss their symptoms, even if their physician may dismiss them. Make sure that they're not doing that, and asking questions. Education and awareness is key when it comes to combating this disease, as well as the disparities in Black women. We have to actually use our voices and become part of the care plan with our physicians, such as Dr. Ratner, an amazing physician who actually invites patients to come in and be a part of their care plan. We need more of that. We need more of these uncomfortable conversations in order to combat the disease, the illnesses, and also the situation where it comes to disparities in Black women, because we have to have these conversations. They're very uncomfortable, but they're necessary. Our voices are necessary. And so we just have to keep pushing to do our part as patients and as advocates, and then the doctors do their part as well, knowing that these disparities exist.
And there's companies like Aspire Women's Health that really does a lot of work to educate women, to increase awareness, and to come up with blood tests that are better for detection for actually all women, but particularly for women of color. So Aspire WH, AspireWomen'sHealth.com is what I would recommend to look at, to really educate yourself about signs and symptoms and early detection and the racial disparities in this field.
All right, thank you both so much for being with us and shedding light on this important topic. We really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.